Okay, good morning, everyone. We're going to start in a second, if you don't mind having a seat. Perfect. Okay, so welcome to day 2. I hope you all enjoyed day 1. Thank you to all the speakers for their wonderful presentations, showcasing the latest in carbohydrate quality and generating important discussions, including in the role of plant oils, fish, and dairy. And thank you for all staying on time. And of course, thank you to Sabrina for helping us to navigate technology and keeping our presentations moving smoothly. Before we kick off for another great day, just a couple quick housekeeping. For people who are still not logged into the Wi-Fi, you can use the Fairmont_meeting, and then the password is DNSG 2025. Washrooms are to both your left and right, so you can't go wrong. And in case you haven't noticed, food is to your right. That's where breakfast, breaks, and lunch will be as well. I am accumulating a little bit of a lost and found here and there. So if you are missing anything, particularly glasses from last night's dinner, that might be important for you to be able to see today. Come and see Sabrina. She has them. Okay, so with that, I'm going to invite Frank and John to come up to start our first session.
Thank you. Thank you very much, Laura. So I'm John Stephen Piper from the University of Toronto, and it's my pleasure to introduce our first plenary session with my co-chair, Frank Hu, will introduce our speaker.
Okay, good morning. It's really a pleasure to introduce today's speaker, Dr. Jordi Salas. Jordi needs no introduction because he's one of the founding members of this group, DNSG. Jordi is a distinguished professor of nutrition and a director of human nutrition unit at the University of Rovira, Virginia, in Spain. He's a PI, one of the PIs of the landmark clinical trial, the PREDIMED trial, and also one of the PIs of the PREDIMED Plus, and also the chair of the steering committee of the PREDIMED Plus. So today he's going to give updates on the findings from the PREDIMED Plus trial. Jordi?
Thank you so much, Frank, for this introduction. First of all, I would like to thank the organizers for inviting me to talk about this, about PREDIMED Plus study, because the PREDIMED Plus, it has taken up approximately 15 years of my life. The last 15 years, we started to draft the project in 2011, and now we are here at 2025. And I hope in 1 year we will present the results in relation to the primary endpoint of the trial. Here you have my disclosures. As you can see, the sponsors had no role in the design on conducting the study. And here you have the table of contents. And the objective is to describe the project and the interest generated among the international scientific community, but also to describe the current status of the trial, the key milestones achieved until now. And also, I would like to show you the most important publications that we have at that moment, evaluating the effect of the intervention, and also to show the most important sub-projects that we have at that moment in relation to omics sciences, and the future collaboration opportunities that the trial offer to the international community. First of all, I would like to thank all the principal investigators of PREDIMED Plus trial, because without them, it would not be possible to conduct this large clinical trial. And highlighted, you can see the steering committee of this clinical trial. What is the rationale for the PREDIMED Plus study? The rationale is that no study has ever demonstrated that weight loss and maintenance using an energy reduced healthy diet and physical activity promotion lowers the risk of cardiovascular disease in older individuals with overweight and obesity. And this is important because when we have someone that has obesity, we try to reduce weight, and we try to reduce weight because we know that we have metabolic beneficial effects, and also we can reduce the use of medication, etc. But never this has been demonstrated using a healthy diet. We do not have information in relation to the beneficial effects on cardiovascular disease using, for example, bariatric surgery, because it's not possible to conduct a randomized clinical trial because of ethical reasons. Now we have, in the last years, we have information about the beneficial effects of, for example, the SGLT1 agonist on cardiovascular disease. For example, it has been demonstrated using semaglutide that this medication reduces the risk of cardiovascular disease. But remember that this is not in real life conditions, because in real life conditions, you can see the curve that has a patient with overweight or obesity. They lose weight, they discontinue the medication and regain, etc. They do the yo-yo that we said. And this, we do not know exactly the effect that has, for example, on sarcopenia or cardiovascular disease. So it's for this that some years ago, we start this clinical trial in order to demonstrate these beneficial effects of losing weight. We have randomized participants, 6,800 participants with between 55 and 75 years with overweight or obesity and metabolic syndrome to 2 intervention arms, an intensive weight loss intervention using an energy-reduced Mediterranean diet plus physical activity promotion and behavioral intervention in order to maintain the weight loss. And we compare this intervention to another intervention using usual care, but giving to them recommendations in relation to Mediterranean diet, but not restricting the energy of the participants. Remember that Predimed Plus is a clinical trial of 6 years of intervention plus 2 years of follow-up of the population that has been conducted in 23 recruiting centers. In red, you can see the Predimed 1 participants, and in green, the Predimed Plus centers that are participating in the trial. In 2011, this clinical trial has been chosen by Nature Medicine as one of the 11 trials that will change shape the medicine in 2023. So we are very stressed because of that, because imagine we do not have the results until now, but in the next year, I can answer you if the stress continues or not. Here you can see the primary and secondary endpoints that we are ascertaining. We have 2 primary endpoints. The first is a composite of myocardial infarction, non-fatal stroke, and cardiovascular mortality. But also another one is weight loss and long-term weight loss maintenance. But we are ascertaining during the trial several secondary endpoints, all related to obesity and metabolic syndromes, such as venous thrombosis or type 2 diabetes and complications, major types of cancer, etc. And we have very well phenotyped the population because we have food frequency questionnaires at baseline and during the follow-up, but also we have information about physical activity, cognition using different types of tests, quality of life, psychopathological status, etc. And also we are collecting at baseline and every 2 years plasma, serum, Baficot, urine, stools, and nails in order to analyze when we will finish the trial. The intervention has finished in December 2022, And this December, we have finished the follow-up of the population. So now we are cleaning the database and in order to do the analysis that of the primary endpoint that probably we will start in September, next September. So we're very happy, but very stressed, as you can see. And here you have the retention of the population. We have had a very good retention, as you can see, during the trial at 6 years of follow-up. At 6 years of follow-up, 72% of the population has had inside visits. 6.3% of the population has been visited by phone. And we have information through the medical records of the 13% of the rest of the population. We have published some results analyzing the effect of the intervention, and here you can see some of them. At 1 year, for example, we have demonstrated that compared to the control group, the participants in the intervention group, in the intensive intervention group, they increased physical activity and decreased sedentary behaviors, increased the adherence to Mediterranean diet, reduced body weight and waist circumference and abdominal fat, induce this intervention a healthier lipid profile, especially in relation to HDL, cholesterol, and triglycerides, reduced HOMA insulin resistance and glycated hemoglobin, and also preserved the cognitive decline. This was demonstrated at 3 years of follow-up. And in red, I will show you some of the results of other analyses. One is in relation to telomere shortening, but also in relation to lean body mass and mineral bone density, and also renal function and kidney disease, and also sarcopenia, because Rocco Barazzoni is here. And he was very interested to see the results in relation to this. These results are not published, but I will show you some of them. We are in PREDIMED Plus, we are very interested in the aging process because it's a population between 55 and 85 years. And for example, we are very interested in telomeres. And we have analyzed it in different populations if there is a relationship between the length of the telomeres and also the adherence to Mediterranean diet. We have demonstrated this association, and we have tested this in PREDIMED Plus, and we have observed that the intervention has beneficial effects on preventing telomere shortening, and this has been published in the Journal of Antioxidants. In relation to sarcopenic obesity, Rocco, we have also analyzed this because we have information of DEXA in 1,500 participants during the follow-up, but also we have the chair stand test in order to analyze the strength, muscle strength. And in relation to body composition, we have published this study in JAMA Network Open, and we have demonstrated that individuals in the intensive intervention group, they have higher reduction in total fat and visceral fat, and also we have observed an attenuation of the age-related losses of lean body mass in this population in the intervention group compared to the control group. And here you can see what happened with sarcopenic obesity. We have observed a reduction in the prevalence of sarcopenic obesity, as you can see here. And we have observed that this intervention induces benefits in terms of muscle strength, but also in terms of appendicular skeletal mass. And we have also demonstrated now Hector, that is here, has analyzed this, and we have demonstrated that this sarcopenic obesity is associated with a higher cognitive decline. So perhaps sarcopenic obesity is one factor that is related to this condition, because we have measured cognition using 8 different tests, and we have analyzed we can analyze what happened with cognition during the follow-up. Also, we have conducted an analysis, and this has been published also this year in JAMA-Net or Open, what happened with the bone health. And we have demonstrated that especially in women more than in men, beneficial effects in terms of bone mineral density, especially at L1, L4. So we can say that this intervention probably compared to the control group mitigate the weight loss, age-related bone mineral density decline that occurs when you lose weight, especially when old people lose weight. Also, we have conducted an analysis in relation to kidney disease. And here is one study that we have published in American Journal of Nephrology 2 years ago, analyzing the effect of the intervention at 1 year of follow-up. And here you can see the Mediterranean diet intervention, and here the non-restricted Mediterranean diet. They have also physical activity, and as you can see, we have preserved the glomerular filtration rate, estimated glomerular filtration rate in the intervention group compared to the control group, but also we have observed benefits in terms of the incidence of kidney disease and also the reversion of kidney disease. Now, this year, we have published in collaboration with people from the center of Malaga in Spain. We have analyzed also the kidney function in 3 years of follow-up of the population, and we have published the results in the Journal of Internal Medicine. And we have demonstrated, here you have the intervention group and the control group, and here you have the glomerular filtration rate, so a lower decline in the estimated glomerular filtration rate in the intervention group and the control group at 1 year, but also at 3 years of follow-up. So we can say at that moment that at least at 3 years of follow-up, the Predimed Plus intervention is probably a good approach in order to preserve kidney function. Here you can see the statistical analysis plan that we have designed before the study, and the timeline for the reported outcomes. You have seen some results that had been planned to be analyzed before the primary endpoint, but as you can see here, now we have conducted the analysis on the type 2, the incidence of type 2 diabetes, and the next year we will start with all other secondary endpoints, at the exception of the incidence of Parkinson's disease and also cancer that has been planned to be analyzed after 10 years of follow-up of this population. Here you have some results that are not published yet in relation, for example, what happened with the adherence to Mediterranean diet. We have here the intervention group, intensive intervention group compared to the control group. We have increased the adherence to Mediterranean diet, a higher increase in the intervention group compared to the control group. Here you have what happened with physical activity also, reported physical activity. In some other individuals, we have accelerometers, and also we have data on this. And here you can see what happened with body weight. We have observed a significant reduction in body weight at 6 years of follow-up compared to the control group, and here the weight circumference. And here the results in relation to diabetes incidence. I can give you some leads that we have observed that those individuals that they lose more weight, so have a lower incidence of diabetes, but the results are now that if you would like to see more, please come next year to the DNSG meeting in Spain, and I will show you all the results in relation to diabetes and also probably the primary endpoint. We are very interested on gut microbiota and omics sciences, the group in general, but also the rest of investigators. We have published several results in relation to Predimed Plus, in relation to this. We have observed beneficial effects of the intervention group compared to the control group on gut microbiota profile, but also in the production of some metabolites of the gut microbiota. And now I will show you some selected ongoing projects in relation to these metagenomics, but also in omics sciences in general that are ongoing. This is one in collaboration with Frank Hugh. He is the principal investigator. There's an NIH project that is entitled Lifestyle Intervention, Metabolites, Microbiome, and Diabetes Risk. The first objective of this project is to evaluate the effect of the intervention of the incidence of diabetes that you have seen the results. Also to examine whether the Predimed Plus intervention modifies the association between metabolite risk score with the incidence of type 2 diabetes. This is ongoing. It's an analysis that we have conducted, but is not yet published. And to examine whether the intervention induces beneficial changes in stool metabolites and gut microbiome. You have seen one of these slides, but sorry. Now it's here. One of the results is this paper that we have published last year, and we have observed the changes on gut microbiota profile and also the levels of metabolites in stools. And these changes have been associated with beneficial effects on several cardiovascular risk factors. So probably is one explanation that gut microbiota could play an important role in order to of the intervention in relation to this cardiovascular risk factor. This is another project that is ongoing that is entitled Advances in Precision Medicine for Obesity, Multiomics and Dynamic Analysis for the Discovery and Validation of Biomarker Predictors of Weight Loss After Intervention in High-Risk Individuals. So the objective of this study is to carry out a multiomic approach for the discovery and validation of markers in relation to the response of the intervention. So the response to intervention is based on the percentage of weight loss at 1 year of follow-up. And in 500 responders and 500 non-responders, we will have data in relation to genomic level, but also at the epigenomic level, because we will have data. We have data on methylation at the whole epigenomic level, and also metabolomics in order to measure different metabolites and pathways. And also in 140 responders and 140 non-responders, we will have the data on metagenomics and also microRNAs in order to delimitate the potential biomarkers related to the response to the intervention. And this is another trial, another ongoing project that is led by Daniel Wong, and in collaboration with different institutions, as you can see, with data from Predimed Plus, 600 participants that we have very well phenotyped cognition. Cognition was very well phenotyped in this population through 8 years of follow-up. And we have we will measure we will have the data on genetic, but also we'll measure shotgun metagenomics and metatranscriptomics and plasma and fecal metabolomics in this population, and several other markers of cognitive decline, and also proteomics. And we will have data of Predimed Plus, and in order to compare with other clinical trials with using Mediterranean diet. And here you have the objective. The objectives are to examine whether gut microbial features modify the effects of Mediterranean diet intervention on cognitive function in Predimed Plus, but also in the Diet Plus trial, to identify microbial metabolites in stool and plasma that explain the inter-individual differences in post-intervention cognitive changes in Predimed Plus, but also in Diet Plus, and to evaluate how Mediterranean diet induced changes in gut microbiome and influence markers measured of neuropathologies. And the idea is to replicate this in other clinical trials. This is the first paper in relation to this because the proteomics has been analyzed in our group, and we have observed, we have delimited a proteomic profile that has been related to cognitive decline. And we have observed an effect modification by lifestyle intervention for this association. And this suggests that an intensive lifestyle intervention using this, the intervention of Predimed Plus may attenuate the age-related cognitive decline through this proteomic profile. So in Predimed Plus, we have a lot of data. I have calculated approximately equivalent to 100,000 textbooks and with more than 1 million of biological samples. And I suppose that this will allow not to us, but also to other investigators around the world to conduct many other studies in the future. And I would like to thank all the Predimed investigators, my institutions, but also the Predimed Plus investigators that are here, the Predimed 1 investigators, and my group of research for giving me the possibility to present these results and, of course, the funding. Thank you so much.
Thank you, Jordi, for that wonderful talk and updating us on Predimed Plus.